Right, go ahead and get started. Thank you all for being here for our Monday COVID-19 vaccine media availability. On the docket today is James English from the Washington County Health District and the COVID-19 response team. And we also have Melody Osborne from Renown who will be available just on the Q&A. So James, if you're ready to go, please start us off.
Good morning, everyone. Since the last media briefing, the Washington County Health District here has administered 3,075 first doses and 1,249 second doses. Between today and the health officer's media briefing on Wednesday, we have an additional 3,200 first doses scheduled here at the health district. We continue to support Sparks Fire Department's pod and Truckee Meadow Fire Rescue's pod with FEMA staff. When we don't need them here, we're trying to help our regional partners as much as possible with either volunteers or FEMA staff. We are awaiting our shipments of vaccine, which we've received all our shipping information for, and will take delivery tomorrow morning. We don't anticipate any delays there. We continue to coordinate with our regional partners regarding vaccine distribution, and I'd like to take this time to thank Sugar Pine Family Medicine that conducted its first community-wide pod over the weekend. Additionally, over the weekend, as all of you have seen or heard, the Centers of Disease Control and Prevention voted to recommend distribution of Johnson & Johnson vaccine with the recommendation to be used for age 18 and older in the United States. And this is an FDA-approved emergency use authorization. Currently today, the Advisory Committee on Immunization Practices is still meeting to discuss the best uses and recommendations for this vaccine. But most importantly, this gives Nevada and Washoe County a third vaccine at our disposal, which will help us quickly vaccinate our community. And as many of you are probably wondering, we did place an order for Johnson & Johnson vaccine on Friday. We requested the full allotment that was available to Washoe County as a region through the state allotment. We expect to see that sometime this week. Once we receive that shipment, you'll see additional appointments both here at the health district and also probably throughout the region. So we'll be waiting for the ACIP's recommendations on best usage of the vaccine and which groups to target with that, or which sort of providers to give that to make the best use of this vaccine. We'll be working closely with the state, and I would fully expect over the coming days, you'll see more guidance and information on this vaccine. Currently, all three vaccines offer complete protection against hospitalization and death. So the key message I just want to give today is we still have a very low supply of vaccine. And with that, people aren't going to still have the option of which vaccine they want. But it's really important to get vaccinated with whichever vaccine is available at the current time, because that'll provide the best protection and get us as quickly as possible allowing our community to return as it was back in 2019. With that, I guess, Scott, you can open it up to questions.
All right. Thank you, James. So we'll have James available as well as Melody from Renown. So please, if you have a question, fire away.
Hi, James. This is Kenzie with News 4. I know Kevin briefly touched on this last Wednesday, but it's my understanding that if the rodeo happens in June, you guys are going to have to pick up and move not only testing, but your vaccination site. Just what's your response to that, and what does that process look like? I assume it's not easy.
It's extremely not easy. We actually have an entire team working on the logistics of vetting other locations, other design layouts, and other operational decisions regarding that. Our location out here has an excess of $500,000 worth of infrastructure and design to have the least impact as possible. It's all modular, but at the same time, it's very difficult to find a location that's both paved, has easy access to both bus routes, the centralized in the community, has easy freeway access, and can move a large number of vehicles through. We're not even close to our capacity at this operation. and we put through over 2,000 people Saturday with very little wait, and also still in less than 6 hours. So this is a big concern here for the health district. It will be a monumental process to actually relocate or even temporarily shut down for the rodeo. We'll have to move all our infrastructure, and finding a location that'll allow the highest efficiency at getting vaccine in arms is what we need to look at. So once we start splitting up into multiple different locations, even with our regional partners, the efficiency won't be there. We'll lose capacity in transportation of vaccine and staffing. If you'll notice, most of our regional partners, when they run community-based pods, they're only in the 100 to few hundreds, whereas we don't even want to operate unless we can get at least 750 to 2,000 scheduled.
Thank you. And I know you mentioned a couple weeks back that the Johnson & Johnson allotment will likely be for the rurals just due to, it's easier to store, it's easier to transport. Or is that still going to be the case? I know you mentioned we'll be seeing more appointments in Washoe County, but are you guys dispersing that out to the rurals as well?
Well, Washoe County Health District is getting their own allotment. So Washoe County as a region is. That is going to be a roller coaster ride, much like the other two vaccinations. As you've heard, Johnson & Johnson, I think, said they have 4 million doses available today, or probably over the weekend when it got approved, with a goal to get 20 million out by the end of the month. We're going to see a large increase of this vaccine over the next 2 weeks, kind of like we saw with both Pfizer and Moderna. And then we're going to see the availability of this vaccine drop off dramatically while they ramp up their production. So the vaccine that's getting shipped right now most likely was produced and has been stockpiled at their manufacturing facilities. Once they get that out, they're continuing to manufacture vaccine just like all the other manufacturers, and we'll be shipping it. But we have been told to expect this large increase. So when I say we're getting approximately 3,600 doses, that's about 46% of the vaccine we got last week in total. But we expect that number to dramatically drop off. We'll work closely with our state partners and figure out, besides the rural areas, do we send it to doctors' offices? Do we utilize it for specific populations or mobile vaccination sites? So these are some of the considerations that committee is working on right now. And until such time that they produce all their recommendations on how best to utilize it, I should know by the end of the week exactly how we will in this region. But we're going to continue to try to make it as easy as possible for our providers to provide vaccine and vaccinations to the general public.
Can you just touch, on the efficacy levels of Johnson & Johnson? I think a lot of people are skeptical because, it's not nearly as effective per se as Moderna or Pfizer, but they say, it's 100% against severe illness and it's 100% against death. And to my understanding, it was tested against different strains. Can you just elaborate into that?
I can to some level, and I received some talking points both from the CDC and the state to assist today. But I think the key message is that, yes, it is 100% effective in not having hospitalizations or deaths. But the other key thing is you can't really compare all three of these vaccinations or vaccines at this point in time, because some of these variants that Johnson & Johnson were tested against weren't readily out there in the communities worldwide, such as the South African variant or the Brazilian variant. You have to remember, we're talking November when Pfizer and Moderna were reviewed and approved. So these continue to be emergency use vaccines, and research and studies will continue to be done on them going forward. But the real message is we have a third vaccine, and we need to ensure as many people will get it as possible.
This is Brian with 2 News. You said that we should expect to see more appointments roll out in the coming weeks as we do get these Johnson & Johnson doses. Is that 3,600 doses? Is that how much more appointments that you're planning to schedule out?
There's 36 additional doses, so somewhere in this community we'll get those out. They may not be here at the health district. Based on the guidance and the recommendations we receive, we may end up distributing that to our regional partners to provide, since the storage of the vaccine is much easier, the transport's much easier, and of course it's a single dose, so scheduling is easier, and we don't have to worry about second dose scheduling. So this is all new information that's literally still being figured out and provided to us. From an operational standpoint, we'll be huddling over the next couple of days to figure out the best way to get this vaccine into our community.
Hi,
So
James, can you just, oh, I'm sorry, go ahead.
Oh, thank you, Brian again. So with the third, vaccine coming out, this Johnson & Johnson. At what point do we think we might start offering people the choice on which vaccine to get, or is that just not in the foreseeable future yet with the current stock?
I don't see that in the foreseeable future anytime soon. The only way that's going to occur is when there is more vaccine supply than demand, and that is currently not the situation here in Washoe County, nor the state of Nevada or the United States. So when we get to a point where this vaccine has been, all these vaccines have been offered to the community, and everyone who wants a vaccination has received one, I think then you'll see the potential for that, to have that choice.
Can you just refresh my memory on our total weekly allotment for the vaccine?
Last week we got just last week's order, which is arriving throughout all our community partners and the health district today and tomorrow, was 7,950 doses.
And with that allotment, since we are getting some of the Johnson & Johnson, is that going to replace any of the Moderna or Pfizer, or are we getting that on top of our regular allotment of Moderna and Pfizer?
No, this is on top. So that 7,950 doses was actually ordered on Thursday. The state reached out to us and said Washoe County as a whole could get a total of up to 3,600 doses of vaccine at Johnson & Johnson. And we immediately ordered that full amount because there is the capacity to transfer vaccine between partners. So if we will most likely deploy some of that out into the community when it arrives. And we work with our partners on planning for additional pods. And this also does not include the vaccine that's provided through all the federal partnership programs. So the pharmacy partnership program with Walmart and Smith's and Walgreens, those are all provided outside of this allotment. They're coming directly from the federal government.
So then just to clarify, that 7,950 doses, that includes the Johnson & Johnson, or is that before the Johnson & Johnson?
That's prior to the Johnson & Johnson. So that was strictly Pfizer and Moderna.
Excellent. Thank you.
Any other questions for James English or Melody Osborne from Renown?
Yeah, I'll ask another one. At what point do you think we're going to be moving on to the next group or the next lane? At what point, since we do have some more of the vaccine, especially with the Johnson & Johnson?
So most of our regional partners right now are working the 65 to 69-year-old age group on the general population side. Additionally, the health district is working on the essential workers, and we're in that end-to-end group right now, which is extremely large. That has all your shipping, all your warehousing, all your manufacturing, all your goods and supply chain services. That's a really large group. We're going to be in this group for a while. The only way we're going to get out of it sooner is if we get larger allotments of vaccine. But it will take us weeks to be able to offer that vaccine to everyone in that group alone. But we are also inviting some 65 to 69-year-olds, as we find sometimes scheduling with employers and businesses is difficult. They need to make sure they can maintain minimum staffing, or that they can schedule their staff when they're coming off shift. So we continue to look at different hours and operational periods for our pod. This past week, we cut back some of our hours based on the delays in shipping with the weather. We're still playing catch up there, but we will probably be continuing to look at some evening and weekend hours for sure, and then continuing our mornings. But we're well into frontline supply chain and logistics. It is probably the second largest, if not the largest group. It's really hard to tell how many employees and employers are in that as more and more businesses relocate to our region.
Hi, I'm Janelle Calderon with the Nevada Independent. I just wanted to confirm something that you said about Washoe County receiving the Johnson & Johnson vaccine. You said later this week. Do you estimate maybe Wednesday or Thursday? Or
I haven't seen the actual shipping papers. I know we're receiving both our Pfizer and our Moderna tomorrow, but I've been told to expect it mid to end of the week. So I would fully expect it to be here prior to the weekend. The rollout for this vaccine probably won't occur regionally here until maybe early next week, but we'll have to work on a plan with our regional partners and with the state on the best use of this new asset in our arsenal to protect the population.
Then when it comes to this Johnson & Johnson vaccine, I know many people in the public have already voiced to us that, you know, if that's the only option, they just aren't going to get it. Is that what you're hearing from some of the public? And again, if you wouldn't mind reiterating the importance of getting these vaccines with the 100% against hospitalization and deaths.
Anecdotally, we do hear that. I think that's really short-sighted, in that if a vaccine's available and it will keep you alive and keep you out of the hospital, you need to take it. Of course, having worked in the response to this pandemic for now in excess of a year, I've seen the toll it's taken on both our businesses, our community, our tourism, and all the individuals and families in this community. So I think if you are offered the vaccine, you need to take it. The only reason you wouldn't take one or the other might potentially be if your doctor's recommending one or the other for some reason, which I couldn't speak to at this point. But yes, it will keep you out of the hospital. They're still doing research on all these vaccines. But the most important thing to know is these are highly effective vaccines. Johnson & Johnson might sound like it's a lower effectiveness, but again, you have to go back to the fact we're continuing to see more and more variants. And unless we can get our communities and our nation vaccinated, we are not going to beat this pandemic back. This virus continues to mutate at a high rate. And the best way to stop that and protect us and get to herd immunity is going to receive whatever vaccine is first available to you to get. And furthermore, everyone has to remember the studies are still ongoing regarding children and younger populations. So when you look at the percentage of our population that's under age 16, we really need our adults to be accepting of this vaccine. And Nevada in general has not had really high vaccination and immunization rates. And I really hope that messaging gets out and we can change that mindset and get people vaccinated.
So this might be too early to know, but do we know yet exactly how long these vaccines are good for? And is the county already making plans to revaccinate those that first got the vaccine, or is there not enough data out yet?
There's definitely not enough data out there, and I would have to defer those questions back to Scott to do some additional research. If boosters or routine vaccinations need to occur, we would fully hope to be out of this pandemic or this emergency response. And at that point in time, you'd be able to go to your general medical provider to get a vaccination like you would tetanus or the flu shot today.
Hello?
Hey, this is Denise from Channel 8. I have a question. It's kind of a two-part question with the Johnson & Johnson vaccine. So I know that you said that you still have an advisory panel looking into the efficacy of this before you really make some big decisions on getting it out into the community. But is there a possible date where we could start thinking about that's the date it might start getting into arms? And the reason why I'm asking is because let's say people show up to their appointment next week and all of a sudden they thought they were going to get the Moderna or the Pfizer, and then they're getting the Johnson & Johnson, and maybe they didn't really want that. Is that a possibility? Someone could show up for their vaccine and then be like, oh, we're giving the Johnson & Johnson today.
That's always a possibility. Based on our shipping delays, we had to change vaccination types twice during those snowstorms, so that's always a possibility. But once again, it really goes to our scheduling, and it also goes to our commitment to the community and to the state following the vaccination playbook that we'll get the vaccination in arms within a week of receipt. So there is that possibility. I would highly recommend anyone that shows up to our pod and decided they did not want that vaccine to please reconsider, because again, these all have various shelf lives, and they have various points in times that they're actually viable and need to get in arms. When we puncture a vial of Pfizer, we have to get it in arms within 6 hours. So that's why scheduling and showing up to your appointments is so important. Additionally, as we invite groups, we do it based on our open calendar, and we try not to invite too many more than we have open slots for, so that you get the opportunity to get the vaccine when your time comes. If you're hesitant to which vaccine you would like to get or you want to choose, it's probably best bet to wait till you get invited in the general public. But I wouldn't think that would be the best path forward at this point in time.
Any further questions? All right, hearing none, thank you very much, James. Appreciate the time and answering those questions. They're really good ones today. As usual, this is recorded and it'll be on our website later today. If you have anything further, feel free to reach out to me directly. Have a great day.
Thank you.
Thank you.